that is pills, psychotropic pills, hospitalization in psychiatric hospitals or institutions, and psychotherapy. And more than 900,000 people, which is 13% of our population, get this kind of treatment. So 13% of the Austrian population take some kind of medication or treatment for their emotional diseases. But when we look more in detail, we can see that about 70,000 people out of this 900,000, Austria has a population now 8.5 million. So you can double it for the Netherlands. Most of the people get psychotropic drugs. 70,000 get hospitalization, and about the same amount get outpatient psychotherapy, which is paid by the state. Not private, treatment is not included. So about 750,000 get pills. Most of them antidepressants, which we know are not useful for mild and middle severe suffering. They have no value. And who is the main prescriber of these drugs? The family doctor. Without any training, without normally, maybe sometimes by nature, but normally without knowing psychodynamic things of the patients, so just victims of the drug companies. So this is the reality. And when we want to change this, we need to look to train practitioners, medical doctors who work in the daily field. Family doctors have to have some kind of knowledge and experience with people who suffer of emotional problems, and maybe this is also a future topic for the academy in the Netherlands. So you see, the field is open, and the question is how behave psychotherapists to these results. It was very interesting to see how the officials worked with this surprising data. With data we, as professionals, said already 20, 30 years ago. And they did not believe, not at all. But now they did a study by themselves, and now they believe. But they were shocked. I remember when it was published, after a short time, silence. But half a year later, just a few weeks ago, they showed the paper what they want to do. And they want to increase the payment for psychotherapy, especially for children. I know that it will take again a few years when it is realized, because there's a big change in the mind, necessary to understand that this kind of suffering is, so to say, real. And it's not just a hobby of nervous housewives, yeah, to go to psychotherapy. So, yeah. So anyhow, so and now comes our responsibility. Responsibility means able to respond. How do psychotherapists respond to this data? On the one side, we are happy because we can say, this is what we always said, and no one believed us. Now you can see. But on the other hand, it is now also, I remember when it came out, all the groups were thinking, now we get a piece of the cake. And who will get the piece of the cake? Is it the psychologists, the trained medical doctors, or the psychotherapists, or others, mediators, coaches, etc., etc. So this is the time now that the psychotherapy leaders develop concepts for making offers which are useful to the people. And you were talking about the clients. In the normal fight between psychotherapists, they often forget that we are here for the clients. And we succeed because we offer something significant to the clients. I remember when I was a young psychotherapist and I was in training psychoanalysis, I was complaining about my colleagues. And hour after hour I was complaining about our fights, and they are unfair and so, and who will win, and the one says to the other, you are not a psychoanalyst because you don't think that way, and etc., etc. And hours for hours I was talking about, and once my psychoanalyst said, by the way, how do you do with your clients? And I said, very well, no problem. And he said, well, you are there for the clients, not for the colleagues. This I never forgot. So we are at the end of the time. Just to summarize, it is important to have a good academic training. And it is important that the academic training consists of both elements, the experience and the knowledge. And this is our concept at the university. And this we will bring together also with the academy, that we accept the experience you make here, and we will add that what we know is important for the profession. This is one point. And the second point is that there is plenty to do for us. We just have to organize the offers. Then the clients will be happy to use it. Thank you very much.